mental health charities criticising a move by the Met Police to stop responding to emergency calls linked to mental health issues from this coming September. The Commissioner, Sir Mark Rowley, saying that officers would only intervene if there was, quote, an immediate threat to life. Well, Sir Mark says that will free up officers and other police resources, but mental health experts say it means officers will be forced to decide themselves if an incident is a matter of life or death, despite not having the right training. Well, let's speak now to mental health campaigner and broadcaster and journalist Mike McCarthy, who can join us. Mike, good to speak to you, even in these circumstances. Thanks for joining us here on GB News. Just to explain, of course, your very personal experience of these circumstances and why help is needed so quickly from the right people.
Yeah, sure. I lost my son to suicide 2 years ago, and Ross had suffered with severe depression for more than 10 years. He went to ask for therapy and was put on a 6-month waiting list, and he died 2 weeks into that wait. I discovered after that, you know, I'm just one person, Ross was just one man, we're just one family, and that there are hundreds of thousands like us who are going through a similar thing. And it made me realise belatedly that the mental health system is broken, it's fragmented, it's the twilight service within the National Health Service. And I think what's happening with the Met Police is perhaps just another indication of how overstretched, under-resourced and overworked people working in the mental health services are.
Yeah, and would this mean that the fact that the Met is withdrawing its involvement from September puts yet more pressure then on the health and NHS part of the equation?
Yeah, what bothers me is that I can understand completely the reasons why the Met would want to do this. You know, in some ways, it's not a police matter. This is a matter for health services. In most cases, the people that they're called out to are a danger to no one other than perhaps themselves. But what worries me is that there doesn't seem to be a plan B. You know, there doesn't seem to be a long-term strategy. And to withdraw from this kind of service, we have to have something else in its place. Otherwise, what is currently a desperate situation will turn into something that is far more dangerous, far more chaotic, and potentially deadly. We have to be able to treat these people properly, and I think we can only do that when we come together, we unify, and we sort out this fragmented system that is failing so many people and taking huge amounts of time from police officers who should be on the front line fighting crime.
Yeah, and clearly Sir Mark at the Met is indicating that I think Hartlepool has had an indication of what can be done in terms of sort of rearranging the police responses. But Mind is saying this is putting yet more problems into the arena, in that the individual police officer will now have to decide whether in fact there is this immediate threat to life, and they haven't got the expert training to do that.
No, and I think that's widely accepted, and most police officers would tell you the same thing. They've told me that they are simply not trained to deal with people properly in this kind of situation, and they certainly shouldn't be spending 9 or 10 hours with them while they wait for treatment in a hospital. But in Humberside, for example, they've tried something like this, and it seems to be working reasonably well, but it's with the support of Mind, the charity, as I understand it, who have people in the police control room. But even Mind are saying that, again, as I understand it, that they aren't happy, that there seems to be no safe transition. You know, there has to be a gradual shift of responsibility if this is the way that we're going. It's not something that can be put together in a couple of months.
Yeah, as you say, Humberside rather than Hartlepool, as I asserted. Thanks for correcting me on that. I mean, given that this complex nature, what then, in your view, needs to happen in terms of trying to get someone to get an overarching view on this?
I think inevitably, and this is not a political thing, you know, because the mental health services have been underfunded, under-resourced for decades now. And again, you know, I think most politicians would accept that. Certainly people working within the mental health services some very good, dedicated, hard-working people know that they don't have the proper resources. And I'm afraid that we're only really going to crack this if there is a unified move, if people come together and work out a long-term strategy, because it's been piecemeal for too long. One county has one solution, another county has another. Yeah. Some of them are better than others. We need to get a grip of this, and it's only at a central level that we can do so.